As South Africa suffers under the strain of a deadly second wave of COVID-19, the need for a vaccine is greater than ever. But as of yet, there are none in the country. When will they arrive? And what is the government's plan to vaccinate South Africa? Many countries around the world have already begun to immunize their citizens, but South Africa is not one of them. By the end of 2020, South Africa had only secured enough supply for 10% of the population through the COVAX facility, an international market in which countries can buy a vaccine. But this will only arrive in the second quarter of the year. This led to harsh criticism from concerned scientists like Professor Shabir Mahdi.
Did we miss the boat? Unfortunately, yes, we did. The government were afraid of an advanced market commitment and undertaking bilaterals because it didn't have roughly about 2.5 billion rand to actually make commitments to different companies, which is probably what it would have taken to secure a vaccine for about 2/3 of the population as a deposit. We simply stubbornly did not engage in those bilaterals, not 6 weeks ago, not 6 days ago, but 6 months ago. The consequences are we're pretty much at the back of the queue.
Professor Frantois Fenta volunteered for COVID-19 vaccine trials last year. His optimism has been replaced with disappointment with South Africa's vaccine rollout strategy.
Even low-income countries have started to vaccinate large chunks of their vulnerable populations. South Africa is a middle-income country. We've got the biggest health budget on the continent. We've got the resources. We've got a sophisticated drug procurement mechanism. And it's not clear to me why South Africa is Johnny-come-lately. We felt like government was asleep at the wheel. There's no transparency from the Department of Health. We don't know whether they've got any plan whatsoever or they've got an incredibly sophisticated plan. But there's this veil of secrecy that they hide behind. They plead poverty. They plead non-disclosure agreements. It's very frustrating.
In response to their critics, the Department of Health held a webinar last week to outline their strategy. Minister Zulim Kiz announced an ambitious plan to achieve herd immunity in South Africa by vaccinating over 40 million people by the end of the year.
We are targeting the minimum of 67% of the population to achieve herd immunity, and the approach will be a phased rollout of the vaccine beginning with the most vulnerable in our communities. The first phase has to deal with the issues of frontline workers. Phase 2 then focus on essential workers, persons in congregate settings. It will deal with the people who are elderly and also those with comorbidities. All in all, we would be targeting about 40,350,000 citizens. These vaccines need to be rolled out to them by the end of 2021.
Prof. Mahdi, we want to vaccinate 40 million people. Is it possible?
Look, it's not possible, right? Right now in the United Kingdom and the United States, they're struggling to vaccinate 50,000 people per day. Now, for South Africa to vaccinate 40 million people, what does it translate into? It translates into us needing to vaccinate for the first month of the immunization program, 150,000 people per day, 7 days a week. And then from the second month onwards, we need to vaccinate 300,000 people per day, 7 days a week till the end of the year to get to 40 million. And I can honestly say if we achieve even 1/3 of the population by the end of the year, that will be a phenomenal success for South Africa. So let us not fool the public in believing that firstly we're going to be able to procure enough vaccine for 2/3 of the population.
The rollout was conceived with help from the Ministerial Advisory Committee. Although he's chairman of the MAC, Prof. Barry Shube does not speak on behalf of the government.
There's a detailed plan which the Department of Health has worked out, which actually went through the details of the distribution. So if your question is, will we be successful? One can just say one hopes so. It is going to be a monumental challenge. But we can't give up. You know, we got to aim for it, and we got to organize for it, and we got to try the best we can.
A crucial component of the rollout is to secure enough vaccine supply.
You certainly are looking at many other vaccines, and some vaccines have not yet been licensed. For example, the Johnson & Johnson vaccine, and there are other vaccines which are coming online. There are something like 280 candidate vaccines which will be investigated, something like 60 of them on clinical trials. So there are going to be vaccines coming online, and we will evaluate them.
Two of the biggest questions about the vaccine rollout strategy are, how much will it cost to vaccinate South Africa, and who's going to pay for it? Government announced that funding will be drawn from government funds, medical aid schemes, and the private sector. Ryan Noach is the CEO of Discovery Health.
We're absolutely delighted by the solidarity that's unfolding between the public healthcare sector and the private healthcare sector. This is a moment that we're actually all standing together and doing the right thing for the healthcare of our nation at large. You know, the vaccination for COVID-19 has now been made a prescribed minimum benefit. All medical schemes in South Africa are now obliged to fund the cost of vaccination for their members. So that means that all adult members of medical schemes will be covered in full for the funding of the vaccinations. In addition to that, the vaccine will be priced at higher than the cost price for the private sector. That surplus will be redirected to fund an additional 15% of the population. And so the medical scheme's role here is to ultimately end up funding about 30% of the South African costs of the vaccination. Our best estimates are that it would not cost more than 7 billion rand to the medical schemes industry. Now, while that sounds like a lot of money, actually it's a very small percentage, about 2% of gross annual premium income, and as a result, quite affordable for medical schemes.
On Thursday, it was announced that the government had struck a deal with the Serum Institute of India for 1.5 million doses of the AstraZeneca vaccine, with the first consignment of 1 million doses due to arrive this month.
We wanted to get fast supply of vaccine as quick as possible to particularly vaccinate our healthcare workers. They are putting their lives on the line, exposing themselves to COVID. And that's why AstraZeneca afforded that possibility.
It's enough to immunize 750,000 healthcare workers. Dr. Sankaree-Govender is one of them.
I contracted COVID in July last year. I was very pedantic and very cautious about my PPE, but COVID still happened. One of our team members at Ezinsha passed away due to COVID. And I can't help but also feel responsible because, as I say, we're doing COVID trials. We're sending our people out into the community, exposing them to people who have COVID, and then they're getting COVID and succumbing to it, which is heartbreaking. We're putting ourselves at risk. We're all facing this virus together, and our only defense at this point is PPE. We know that the vaccine is coming. It will better equip us to provide peace of mind for not only for the patients, but for ourselves and our families as well, knowing that there's a less chance that we'd be taking the virus home to infect them. And that we really see as a beacon of hope. We think that once we get the vaccine, things will get better.
The rollout will start in the next few weeks, but the task ahead is enormous. Government still needs to procure enough vaccines to immunize a further 57% of the population. Then there's the huge logistical task of distributing it. This will require partnerships with the likes of companies like Clicks and Dis-Chem. It is an undertaking we dare not fail at.
It's life and death, McFarlane. It's the health of families and people around us. It's the recovery of our economy that's on the line. It's a humanitarian crisis that we're needing to address. And the best tool that we have in our pocket at the moment is the vaccine.